Good afternoon, everybody. Welcome to Mental Health Talk with yours truly. I am Christina McIntyre. I hope that y'all had the best week that you could. And remember, don't worry about yesterday, it already happened. Let's focus on the now and moving forward towards the future. Um, so, I'm sorry, I'm a little bit scrambled. Um, Sorry, this week's topic is OCD and mental health. But before I get to that, don't forget to visit my website, www.becomeyourc.com. Follow me on Instagram, Become Your C. I share a lot of good information on there, some of my poetry as well. Facebook, BYC, Become Your C. Also, YouTube, BYC Become Your C, to stay up to date on my podcast. And also, I am on TikTok at Become Your C. I share some good information about mental health, dealing with the chakras and all that. So make sure you subscribe, pay attention, and also on my website, I have my chakra jewelry for sale. I have bracelets and necklaces. I also updated my keychains so they look more happening. So definitely go there and subscribe and then stay up to date on all that good information. Again, the topic this week is OCD. OCD affects a lot of Americans. One in five people suffer from mental health disorders each year. About, let's see, one of out of every 80 to 100 adults, which is about 3 million people per year, suffer from OCD. And I'm going to give a brief definition of OCD in a moment. Women are 1.6 times more likely to suffer OCD than men, and OCD is ranked number 5 out of all of the mental health disorders. So it's definitely a disorder that affects a lot of people, and also OCD doesn't exist most of the time by itself. Most of the time, OCD exists with anxiety and depression as well. So, OCD stands for Obsessive Compulsive Disorder. It's a mental health disorder characterized by repetitive actions that seem impossible to stop, having a tendency towards excessive orderliness, perfectionism, and great attention to detail. So some of us, we like certain things organized. That's fine, but when it becomes an excess, like if you can't do something, it causes you severe anxiety or causes you to think obsessively, you may have OCD. According to National Institute of Mental Health, OCD is chronic. It is long lasting. It has uncontrollable recurring thoughts, and those are considered obsessions and or behaviors that need to be repeated. So the thoughts is the obsessions, and the behaviors behind that are the compulsions. And there are signs if you have OCD. And the first category is obsessions. Okay, obsessions is repeated thoughts, urges, or mental images that causes anxiety. So we have normal everyday thinking. We all think, but when your thought process becomes overwhelming, it starts to not make sense. Like I have OCD myself, and I struggle with it on a day-to-day basis. Um, you create situations that's not even happening, that may never happen, but in your mind it's happening and it's happening to you. And it does cause a great deal of anxiety because your cell, I believe our cells listens to our thoughts, right? And so what you're doing is sending you know information to your cells that you're under attack. And so in turn, it causes anxiety, it causes panic. If it's too often, it can cause depression as well. And so when you have multiple disorders going on at the same time, it definitely will bring you down. It definitely affects your ability to live a so-called normal life. Um, some some examples of what obsession is: a fear of germs or contamination. Now, it's great that we wash our hands and we like to stay clean and stuff, but when these become obsessed, like people that wash their hands constantly, to the point sometimes they have like scabs and things on their hands because they're doing it too often, that is a obsession. unwanted, taboo, or forbidden thoughts involving sex, religion, or harm. Any thoughts are good. Thoughts are good where people were allowed to think. But when these thoughts affect your everyday to day life, right, you can't function because they feel intrusive, right, and you can't stop them. That's when it becomes a problem. Aggressive thoughts towards yourself or others. Um, we feel down sometimes. We sometimes think bad things about ourselves, but when it gets to the point where we feel like we need to harm ourselves or others because maybe a voice in our head is telling us to, you may have an obsession. And also definitely go get checked. If you feel like you're a harm to yourself or others, definitely call 911. Get into some crisis because you definitely need help. I know like having mental health disorders can affect your ability to think rationally, but if you feel like you're putting yourself in harm's way or others in harm's way, definitely go out and get some help as soon as possible. We want you here. We want you to live. We want you to have a vibrant life. And it's okay that you have these things. Your job is to go get the help that you need so you can have some normalcy. Having things in symmetrical order or in perfect order. So we all like cleanliness. We all like things the way that we want it. But when it comes to the point where if it's not in that order, it messes up your whole day. For me, I have a weird thing. Like I know where certain things are in a space. So if it's out of that space, it can and it has caused me severe anxiety. I can get upset. It used to be worse when I was younger. I kind of got a little bit more better grasp of it. But yeah, like it messes up your like. For me, it'll mess up my train of thought knowing that this thing is out of place, so I have to go actually and fix it so that that seems okay to me. um like I said before, like some order is okay, but when it messes it up, like it triggers you, that is a very bad obsession. So compulsions. Compulsions are repetitive behavior that a person with OCD feels the urge to do in response to an obsessive thought. So the obsession is thoughts. The compulsions is the behavior behind those thoughts. And some examples are these are excessive cleaning, hand washing again, ordering and arranging things in a precise way, repeatedly checking on things such as making sure doors are locked, and compulsive counting. And so you might have seen people that do it. I know people that my mom has OCD too, so she wears a watch, and so every like I paid attention to her one day. It was like every minute she was checking the time on her watch, pulling hair, counting. If you ever see people counting like 1, 2, 3, 1, 2, 3, it is a technique that some people use with meditation. Counting can be good, but if this is in a form of a ritual, this is a compulsion. For me, I can relate to this. So I have a fear of my apartment burning down. So I always check before I leave the oven to make sure that it's off. Um, I'll check it. I'll check it again, probably two more times before I even leave the house. A couple times I have been in the car ready to go, and in my mind, I left the oven on, so I had to get up and go and make sure the oven was off, even though I knew I turned it off, even though I checked 4 or 5 times. I still had to go and make sure that it was off. So that is a compulsion. I am working on it. I'm trying to get myself together because it does affect, like, let's say you have to be somewhere on time. And so when you have these compulsions, it actually affects that time, right? You have to make sure these certain things are done, or you cannot go anywhere, or you're going to constantly think about, oh, what if I didn't do this? Oh, I need to go back and do that. And so it can actually prevent you from doing the things that you need. Years ago, I read the story about a woman. She couldn't even go out of her home because she had to check the doors a certain time, and she involved hers with counting. And if you mess up a count, you have to go back and restart. And so for her, it kept her trapped and hidden in her own home. It isolated her from society. Also for me, I used to check my car doors when I wouldn't get out, like 3 or 4 times to make sure I locked it. Even though I'm clearly looking at the lock, I see that it's locked, but in my head, I have to make sure that it's locked. So yes, these compulsions and these obsessions can drive you crazy if you don't get a hold of it. And it definitely takes time um, to get a hold of it, but it's definitely doable. You have to work on it yourself. Like I used to take therapy, but I chose to try to get myself together by introducing, I will call the chakra healing, and learning how to figure out a different routine and different way of doing things. That way that I can combat this disorder. You can't control thoughts or behaviors even when they're recognized as excessive. So you want to live a normal life. You want to get these things under control, but you just can't. You've tried and tried, and it just doesn't seem possible. So again, talk to your doctor, get a very good therapist. Sometimes you have to seek multiple people before you find someone that fits what you need. Um, People with OCD don't get pleasure from performing these behavioral rituals, but they have to. Like it's a need that they have to do, just like we need to shower and we need to brush our teeth. They can't live not doing these things. If they do, it'll cause. They feel like it's gonna cause them danger, right? It's gonna affect them, so they have no way around that. Experiences significant problems in their daily life due to these thoughts again. So all these thoughts, the obsessions, the compulsions, it affects the way that people with OCD have it every day. Like their day is not considered normal, or it won't appear as normal as someone else's because they have these certain things. And if you know someone that is suffering from this, be patient with them. They're trying as much as they can to live a normal life. And sometimes it might take someone to like um, interrupt it, right? Not like abruptly, because you can throw someone with OCD off, and you don't want to do that. But just go in gentle. Sometimes having conversation with someone may put their mind at ease, may channel their energy towards something else. Um, Also, people with this disorder have compulsive behaviors, intrusive thoughts, again, anxiety, sexual obsessions, and a compulsive hoarding. And hoarding is when you collect a lot of things and they just start piling up. And if you ever seen the show Hoarders, you know what I'm talking about. They have an OCD issue problem, and they can't control it because they feel like they need these things and they have to have these things, or at some point in time it could be useful, but in reality, like if you ever seen the show, some people have a lot of infestation with bugs. Some have like obsession. Like one person I saw had like 40 or 50 cats or dogs, I can't remember which one, in their home, and they thought that they were doing actually good, but they were living in a way where it was affecting the owner's health and the pet's health as well. So someone had to come in and take it out. It can be a whole mess, and people with OCD don't see anything wrong with their behavior, and so. It's important if you know someone that's suffering, so especially someone that is older, to check in on them often. And we should definitely check in with the people in our lives that we know that suffer from mental health issues. Sometimes we isolate ourselves because we feel like we're going to get judged and criticized, and for us, we can't handle any more than we already have. So be patient with them, be kind, check in often to make sure that they are okay. um, People with OCD has some people have what they call a tic disorder, and so a tic disorder is um, sudden, brief, repetitive movements such as eye blinking, facial expressions, shoulder shrugging, head jerking. You can do things with your hands. Um, Often, and then they also have something called vocal tics. It's repetitive throat clearing, sniffing, and grunting sounds. So if this relates to you, you think that you have OCD, definitely get checked. You can do your research online, and definitely, if you feel like you need help in this matter, there are people out there that can help you. And if you're not ready to go to the therapy route, because going to a therapist and saying there's something wrong with you can be scary. They have a lot of groups on Facebook. And definitely, that's where I started my journey at. Like, I belong to a couple of different ones, just to, sometimes you feel better knowing that someone out there is dealing with the same thing as you. You don't seem as crazy as I guess normal people make it seem. And so it's important to be able to, if you're not used to opening up to people, to slowly do that at your own pace. But definitely knowing that you don't have to suffer by yourself. There is help out there, and get whatever help that you need that could be beneficial to you. It could be therapy. Some people use religion as a healing mechanism. I use the chakra system as a healing mechanism for myself. And just remember that nothing comes easy. It's going to take consistency on your part, making sure you stick to your new way of doing things and not allowing your thought process to put you back into where you used to be. And that's something that most people with mental health disorders struggle with. They struggle with going back to their old self because that's what they're used to, right? It's a comfort thing. We always want to go stay where we're comfortable at. And then when we're trying something new and we're doing new things, it feels strange. It feels different. It feels like it's not even who we are. But at the end of the day, if you want something to change, you have to do new things. You have to try new things and not allowing those thoughts to control you. And that's what it is. Those thoughts and compulsions, they control our life. And we feel like we have no control over it. And so we basically doing what those thoughts tell us to do, even though it's causing anxiety. And that's what's crazy about it, is that we know that it's causing us anxiety. We know that it's causing us depression, but we cannot stop it. And we're trying to stop it. And the only way to combat it is to get the help that we need and recognizing that it is an issue. And some people don't want help, so you have to leave them where they're at. But definitely, if you know someone, just be there as a friend. We can only do but so much. And so don't force help on someone if they don't want it. Just be of encouragement. Let them know that, hey, you can go get help if you need. Let them know that you're there for conversation if they want to talk about it. Some things can be solved by just conversation. So if they come to you with some issue, just listen. Sometimes I think we speak too much and we don't listen often, and I think we need to just practice that more, listening more, so that we can actually hear what's going on. Also, some risk factors that contribute to having OCD are genetics, right? So it's important to know where we come from. Genetics play a role in a lot of mental health issues. I know for myself, my family suffers from mental health issues, and so it's a comfort knowing that other people, like, we're not in this again by ourselves. And also your brain structure, right? Your brain structure and functioning. So a lot of times people with OCD, their frontal cortex is affected, and that's why they do these behaviors. And your environment also affects why you get OCD. A lot of childhood trauma, undealt with pain. For me, I believe that we carry burdens of our ancestors. We are a replica of everything. Like, we're half of our parents, so their DNA is within us, right? And so their parents, our grandparents, their DNA is within them, which is in us. So everything gets passed on. So undealt with trauma, undealt with pain can contribute to why you have OCD. And I can think back to my childhood. Definitely a lot of pain that wasn't dealt with that still affects my life now, and it takes consistent working on it in order to improve it. But realizing that that's where it came from can get you on a start. Also, having strep throat as a child can affect the outcome of OCD as you get older. There are two different types of treatment, or about three, for OCD. Again, medication is always an option. If you're not into the medication, you have therapy. They have psychotherapy, and also cognitive behavior therapy. And it basically changes the way you think, or also puts you in situations where your OCD is challenged, and so they're doing something to um, channel that that thought process, those compulsions and stuff. And again, this takes time. Anything you choose to do takes time because it this this just didn't happen overnight, right? So it's going to take time for you to actually know where the problem is, right? We have to figure out where the problem is at. We have to come up with a solution for it, and then we have to put that solution into practice. And that's the hard part. That's what anything in life, like trying to make a change and being consistent in the process, it is get hard. You get tired. You feel like this is all for nothing, and so you go back to the old way of doing things, and then causes more chaos within you. So definitely, if you find something that's working for you, see it through. And remember, this is not just, oh, I'm going to do this for a short term and then that's it. No, everything that you do is going to require a long term, right? Mental health disorders just don't go away. A medication can help momentarily, but the issue is still going to be there. Now it can, just like therapy. Therapy can help, but the issue still going to be there. So we have to find where the root cause of the issue is at. And once we find the root cause, we can come out with a better solution. Again, OCD is related to other disorders as well, and anxiety, depression, also body image, right? So having OCD can affect your body image as well, how you see yourself. And so it's important to pay attention to your thought process because we become what we think. And if we are not thinking good thoughts, that affect us not only mentally, but emotionally and physically, and I believe spiritually as well. Trying to change your thought process, that's difficult if you're used to one way of thinking, but practicing over and over again, I like doing mantras. Mantras are just sayings you say to yourself to keep yourself uplifted and tell yourself. It sounds crazy, but look yourself in the mirror, especially if you're struggling with self images you and tell you you're worth it, you're valuable, and all that stuff. Now it seems crazy in the beginning; it doesn't even seem real, but after a while, you'll get used to it. You'll start to believe it, and you'll feel better about yourself. OCD people struggle with self-esteem. They um they feel embarrassed and they feel insecure, right? Because we feel like what's going on with us, like we might be a little bit crazy. And so all these thoughts contribute to why we feel the way that we do. So getting a hold of it can actually improve our quality of life. Um, and if you ever feel like you don't want to be here, if you feel like suicide is an option, please know that that does not have to be an option. There is help, and you can get the help that you need. The hotline for the suicide is 1-800-273-8255, or you can visit the website suicidepreventionlifeline.org. I know how it feels to suffer. I've been suffering for a long time, and I'm, I feel like I'm at the beginning stages of it, but I'm taking control over my life. And so it's important that you take control back over your life and knowing that the help you need. I struggled with suicide when I was younger, and I know how it feels to just want everything to go away, but that's not a solution. Um, I know that life can feel overwhelming, but there are options out there. And so taking control back over your life, even just for a moment, right? Allowing someone else, because we all need help at some point in our life. We don't exist by ourselves. We can't exist. I mean, we do, but we can't exist by ourselves. We weren't made to be by ourselves. And so it's important to know that it's people out there that's willing to help you. And you just got to know that you deserve the help, you are worthy of the help, and that you can live whatever life that you choose to with these disorders. And that's what therapy does, that's what medication does, that's what healing does. It gives you a better chance at having the life that you want. And then I'm gonna relate OCD to the chakra, and then we're gonna end it. So for me, I use chakra system as a healing tool for me. I'm dealing with my mental health issues, and chakras are energies in our body. We all have them. We have seven of them, and so OCD is related to our solar plexus chakra, and that is the third one, and it's below It's right in our belly, upper belly area, right? It's responsible for power, self-esteem, self-worth, self-confidence. And so when this is not balanced, it causes OCD behavior, anxiety, and all that stuff. And so in a way to heal that is by one, meditating. Meditation is good. You're speaking, you're bringing positive energy into yourself. Getting a lot of sunshine. Sunshine effect is good for our skin. It's good for our vibes. Take a walk on a nice day. Most of the time, I feel better after a brief walk. So do things that can help. Eating yellow foods, having crystal citrine is good for self healing as well. Um, so definitely, whatever option you choose to heal, pick one because you definitely need it for yourself. You definitely deserve to be here. You have purpose, and make sure that you find something that works for you. And one more thing, OCD affects relationships as well. It impacts intimacy. Um, People that are that don't like touching people. So if you're in a relationship and you have OCD and you don't like touching people, it can affect that your partner won't get the affection that they need. And then also putting too much pressure on your partner, they feel overwhelmed by your OCD behavior, right? Like, let's say you're a messy OCD person and your partner is a orderly person, is going to create imbalance in your relationship. It lowers happiness in the relationship because your OCD behavior is paying attention to that person, and like um, when you have OCD, you want everything to be perfect, right? And so if your partner doesn't meet this perfection that's in your head, it creates issues, right? It pushes the people away. Y'all feel isolated. Y'all feel like y'all bumping heads. And so in trying to understand your partner role in your um, behavior can help you as well, like letting them, and also communicating. I put that there. Communicate with your partner, let them know what you're going through. No, they may not be able to help you, but at least it's a start, right? Having that open door of communication can help the relationship, but you can't expect the relationship to be what you need if you're not willing to do the work it takes. And it is a struggle being in a relationship with someone that has OCD, but we're worth it, right? We deserve happiness too. We want to be with people that bring us happiness, and we want to be able to thrive in those relationships that bring us happiness. And we have to do our part in it as well, right? We have to let people know, hey, this is how we're feeling, this is how we're thinking, because sometimes our thinking can be way out the box, right? And it causes issues. And it could be something simple that could be resolved through conversation. That's why communication is important, not only for yourself, but for your partner, for other relationships that you have as well. If we don't communicate what we want and need, how can we expect someone to know that? People can't read our thoughts, right? We don't even want to read our thoughts. And so it's important that you let others know and let others in. And the trust factor also contributes to this as well. It's hard to trust people, especially when you suffer from mental health disorders, but opening up yourself and being able to have that safe space, especially if you have a partner that is loving and trusting, allow yourself um, allow yourself to know that this person cares about you, right? And it's important to have people around us that love and care about us, that we don't drive our own self crazy, because sometimes that thought can spiral out of control, and then it creates other issues. So be open, allow these people, and knowing that you're okay, how you are. There's nothing like real. I mean, there's something going on, but there's nothing wrong with you, right? We are not our diagnosis. We are more than that. And knowing that will help you live the best life that you can, knowing that you have that safety net, right? That outlet and that encouragement and that love will definitely see you through. I believe that love can heal a lot of things, and so allow love to heal your OCD. I want to thank y'all for tuning in each and every Sunday at 12 p.m. on stayinpradio.net. Make sure you tune in again. Also, don't forget to visit my website, www.becomeyourseed.com. I talk about the mental, emotional, physical, and spiritual aspects of ourselves. Also, YouTube, BYC, Become Your C. Stay up to date on my podcast. Instagram, Become Your C. I share a lot of good information on there as well. Am I missing one? Probably, I don't know. And I'm also on TikTok, Become Your C. If you're interested in the chakra jewelry, let me know because I have it available. It can help you and aid you on your spiritual journey as an option. Um, in addition to regular traditional therapy, this is a holistic therapy. Today and each and every day, I want you to honor yourself. I want you to love on yourself. I want you to know that no matter what you're going through on the outside, you can live the life. You can live your life the way that you see it. Create your reality. Create what you want it to be. Fall in love with yourself so the world can fall in love with you. Until next time.